The man did great. His lipid levels were absolutely impressed, better. He actually lost weight too. He felt amazing, so it was fine. There was no problem. So when you eat the sugar, it goes to the pleasure center in the brain. Because teleologically, it was a quick source of energy, so you wanted to feel better about it. So for some reason, it goes straight to the dopamine receptors, and it is addictive. But remember now, when you're not feeling good, when you're not eating the sugar, it may be because you're going through sugar withdrawal, but it may also be that your sugar is off itself. So you got to make sure when you're feeling bad like that, that your sugar level is tested. And make sure you're not relatively hypoglycemic. You may be overdoing it with your medications. And that's why when you then eat, you feel better. But there's a true addiction, and the way to overcome it is what I'm saying here. You just have to pull yourself through it. Just make sure you're not becoming hypoglycemic. But you got to have the willpower not to cave in and eat sugar, because the next sugar you eat again will give that bump again. You must have persistently low insulin levels. You have to bring that down. You got to get it down. Your sugar, you must test it to make sure it's not due to sugar. Okay, so because we didn't get the 5-hour samples, I just did a fasting insulin, and you all know that fasting insulin didn't really mean much, but I had him do a postprandial, 2-hour postprandial level to show that it's up, because most of the patients, the insulin will be up if they have an insulin problem. So that's just to save him some grief because of the test. But no, yes, you will do another 5-hour test in the future, but for a different reason. Because in the meantime, if you abided by all those instructions, and if you lost weight, and if you now feel better, when you repeat the test, now you will see that your insulin response is normal. When your insulin response is now normal, I can say, hormonally modified person, you have now normalized. So now when that person goes out and maybe once in a while has a high-carb meal, he's not going to produce that massive amount of insulin again because he's insulin sensitive. So the goal here in the diet that I'm telling everybody to do is to restore insulin sensitivity, not that I'm telling you that for the rest of your life you're only going to have 1 meal a day and you're just going to suffer. No, that's not the point. The point is through the fasting program, you'll lose weight, regain your sensitivity, which can be tested with another 5-hour test, and then now you are back to the way you were young, when you can eat 3 meals a day, but you will know that you need to stay away from sugar and fructose, and your insulin responses will be normal. You won't gain weight, or you won't get atherosclerotic disease. So please understand that this is a therapy. This is not telling you that for the rest of your life, I only want you to have 7 meals a week. That's not my point. It depends on your goal. So in a patient who's terribly overweight, I'm going to encourage you to do it as often as you possibly can and how comfortable you feel with it. But if you're just doing it for health reasons, you're just doing it because you're not overweight, your insulin's okay, your sugars are okay, but you just want to remain healthy, and that's why you want to keep your insulin sensitivity, then my advice is to do it twice a week. Because the day after you fasted, your insulin sensitivity is going to be there. So even you diabetics who fast, the next day, whatever you're going to eat, your insulin levels are actually going to drop with the same meal. Why? Than before? Why? Because you're more insulin sensitive. And that sensitivity seems to stay for 2 to 3 days. And that's why 2 to 3 days a week, you should do the once-a-day fast. And I think that'll be very, very healthy for health maintenance. But if you're overweight and you want to do it for that, well, then you do it every day till your weight comes down, till your waist comes down, till you want to stop. And if you really want to know how well you're really doing, then you do your blood tests. You know, you do your HDL, your triglycerides, you do a 5-hour insulin test, and now it's all normalized. Well, now you've hormonally corrected yourself. If you're a vegan, then again, there's a danger for all vegans and vegetarians to eat too much carbohydrate. So many vegans and vegetarians think that they're on a very healthy diet when actually they're not, because they are eating too much carbohydrates. If you want to know whether you're in trouble with eating too much carbs or not, then there's simple things you can do. One is, of course, you do the insulin test that I've recommended, and you look at your HDL and your triglyceride ratio, and look at your weight, and then you'll know whether you're eating too much carbs or not. And within your diet plan, Eat foods that are less processed, so no bread. Vegans think that they can go out and eat a loaf of bread. Look, I'm a vegetarian, and they eat buns, and they're eating all sorts of stuff. That's all processed stuff. So stay away from sugar still, stay away from fructose, eat complex carbohydrates, no refined flour. Even though you're a vegan, don't eat refined stuff. Eat more of the rough stuff, and you'll be much healthier. No. This is type 2 diabetes. Type 2 diabetes is caused by high insulin levels.
Okay.
Type 1 diabetes is when your pancreas no longer makes insulin, and usually occurs in younger children, is detected at a very young age, and they usually need insulin shots. However, 10% of type 2 diabetics, years and years after they've been diagnosed as having diabetes, the sugars continue to go high, can morph into type 1 diabetes because the insulin levels can fall, and then you measure it and you say, oh my God, your insulin levels are really low, they may now need insulin. The physiology has become type 1. Yes. Yes, any fasting is good. The effects of fasting don't only last that one day. The effect of that fasting will last you days and days and days to come. So even a one-day fast has a profound effect on your physiology that's going to last for days. Folks, don't underestimate this. So don't think it's a failure. Oh my God, doc said, fast, and I only fasted one day a week. So what? It's okay. That's good to do. Your body should be stressed. It's called hormesis. What is the definition of hormesis? Hormesis is a type of physiology that puts a stress on your body. And when it puts that stress, it changes your entire expression, your genetic expression, so you become healthier and stronger. Fasting is one of them. It's a strong hormetic. Heat, sauna, that's another form of hormesis. Turmeric, that's hormesis. A lot of things that we actually do are hormesis. And that makes you stronger and better physiologically. If your insulin levels were high and your sugar levels dropped, you got functional hypoglycemia. So you're a pre-diabetic. So therefore, your sugar's running too low. Why did they drop? Because you ate too much carb. So you brought too much insulin into your bloodstream, and therefore 2 hours later you crashed. So what is the treatment for that? The treatment is cut out all the carbs and all the sugars. You need to really reduce your glycemic load and the amount of carbs in your diet. Then your insulin response will not be so sharp and so high. Then you won't get the reactive hypoglycemia down the road. That's number one. Number two is you got to see why you're becoming insulin resistant. So causes of insulin resistance. Now, this is very important. All of you should take note on this. I told you it's fructose. Number two, branch-chained amino acids. Amino acid branch chains. So if you're taking protein powders, you are going to become insulin resistant. All of you who are taking protein powders, you got to be careful if there's too much branch-chained amino acids. Okay? And number three is polyunsaturated fats. Cut those out from your diet. And lastly, number four that causes insulin resistance is some medications that you might be on. You need to cut those out. So you're going to look at your medication list and just see. Oh, one more thing, corn-fed animals, you eat that, corn-fed animals, they have a lot of branch-chain amino acids, you'll get insulin resistance. So if you have insulin resistance, you need to avoid corn-fed animal meat. You need to go to grass-finished. You got to insist that it's grass-finished meat. So any animal that has been fed with corn will have high amounts of branched chain amino acids in them, and that causes insulin resistance. So her problem is not only about changing her diet, but she also got to change other things. The branched chain amino acids have to go in protein powders, animal products. So you want to have, if you're going to have an animal product, it's got to be grass-finished. And you got to eat more fish, and you'll notice your insulin resistance will get better. If you have atrial fibrillation, And if you're over 75, if you're a female, if you have diabetes, especially, or if you've had a stroke before, or TIA, you must take a blood thinner because the risk of stroke is very high. So yes, atrial fibrillation, you need to. Now, having said that, you need to define what atrial fibrillation is. Is it constant atrial fibrillation or intermittent atrial fibrillation? That's number one. Number two, you got to look for the cause of your atrial fibrillation. Because if you treat the cause, you may not actually have so much atrial fibrillation or very little, or even cure it. For example, if you have a valvular disease, uncontrolled hypertension, or obstructive sleep apnea, or if you have any underlying issue. And last thing is metabolic syndrome. I've got lots of patients who don't have valve disease, high blood pressure, nothing, but they have metabolic syndrome. And when I treat the metabolic syndrome, the atrial fibrillation goes away. There's an epidemic of atrial fibrillation going on because of metabolic causes of atrial fibrillation. So your answer is complicated. If you're in it, and you know that there's no way you're coming out of it, then you should take a blood thinner to prevent a stroke. On the other hand, if you can find an underlying cause and reverse that so you don't get the problem in the first place or cure yourself of atrial fibrillation, then that's the supreme way to go.